So welcome everyone, and thank you for watching our Building Back Differently Older Adults webinar. My name is Amber Kolababa. I'm the coordinator of the Trent Center for Aging and Society, as well as the Rural Aging Research Program at Trent University. I'm joined by Anne McLeod, faculty in the Trent Fleming School of Nursing and faculty member of the Trent Center for Aging and Society. Today, we'll be providing an overview of our contributions to Building Back Differently, a collaborative project between Trent University researchers and community experts that pulled together local data and experience from the Peterborough region to help envision a healthier, more equitable future in the wake of the COVID-19 pandemic. Surrounding the theme of building back for older adults, our report shared research on the experiences of older adults during the COVID-19 pandemic and ways that we can help to support and sustain aging in our local communities. So our report, led by Trent University's Rural Aging Research Program, which is coordinated by myself and led by Dr. Mark Skinner and Dr. Elizabeth Russell, discusses our recent research that examines the impacts of the pandemic on older volunteers, volunteer-based programs, and aging in rural communities, and provides recommendations on moving forward towards a sustainable older volunteerism in a post-pandemic society. So a little bit about who we are. So the Rural Aging Research Program is a community-based rural aging research group based out of the Trent Center for Aging and Society at Trent University. And that's myself, Mark, and Elizabeth there. If you'd like to learn more about our past and recent research, you can visit our website at trentu.ca/ruralaging. And I just want to quickly acknowledge our funders and collaborators. So the research was funded in part by Trent University's Office of Research and Innovation and the Canada Research Chairs Program. The project was conducted in collaboration with the Abbeyfield House Society of Lakefield, the Selwyn Fire Department, and the Selwyn Public Library. So rural areas internationally in Canada and specifically in Peterborough County are experiencing population aging. Those communities use volunteerism as a way to provide services to aging rural residents that would otherwise be missing from the community. Volunteerism can act as a way to sustain community services and also as a site for social participation for older adults who choose to volunteer. This concept of older volunteerism, where older volunteers are providing services to aging rural communities and aging rural residents, is challenged by the demographic reality that the rural volunteer pool is aging. And how do we sustain that when it's older adults who are providing services for older adults? Large-scale global crises like the COVID-19 pandemic create additional challenges for older volunteerism and raise the question of how do we sustain volunteering during the pandemic when physical distancing measures, lockdowns, gathering limitations create barriers to volunteering and social participation. And this can increase a risk for social isolation, a topic that Anne will cover a little bit more directly in her presentation. So in order to explore the challenges of older volunteerism during the pandemic, we conducted a first wave COVID-19 research in Selwyn Township in Ontario, conducted between June and September 2020. Following provincial guidelines for stay-at-home orders and physical distancing, our interviews were conducted virtually, either through Zoom or over the phone. Interviews, we had interviews with 34 participants in total, a mix of volunteers from the organizations as well as program administrators. We recruited participants for this research project using past pre-pandemic research and collaborations. This pre-established rapport with our participants between them and us as a research team made for a really effective research uptake during a pandemic where we knew each other and we had already had these kind of discussions. So those are the participants that we contacted for this study. Participants were predominantly male, were an average of 65 years old, and were long-standing volunteers in their respective organizations. So as mentioned previously, the research was conducted in collaboration with 3 volunteer-based rural services that primarily used an older volunteer base. And these were chosen to represent different sectors of volunteerism found within the township, as well as chosen due to pre-existing partnerships between the organization and the research team. So the Abbeyfield House Society of Lakefield is working towards providing affordable seniors co-housing for residents of Lakefield. At the time of data collection, so June to September 2020, there were 8 older volunteer board members, and during the pandemic, they switched their meetings from in-person to virtual using Zoom. The Selwyn Fire Department provides emergency services to the township. At the time of data collection, 92 volunteers were across 5 different halls, with many of these volunteers being over the age of 65. During the pandemic, the Selwyn Fire Department increased their personal protective equipment for their volunteers and amended policies to ensure volunteer safety, like they moved their training to online versus in person. The Selwyn Public Library provides library services across the township. At the time of data collection, they had many volunteers and many were over the age of 65. During the pandemic, at some points, the library ceased in-person library services, so doing everything virtual, curbside, but that included using volunteers as well. So 2 major findings emerged from the research to reveal the way that Selwyn Township kept volunteerism sustainable during the pandemic. And the first was resiliency, where volunteers displayed a show must go on attitude despite the pandemic. Volunteers remained resilient to continue operations in some capacity for their community. Older volunteers in the fire department, for example, continued to attend medical calls despite their age and risk of contracting the virus. As this particular quote alludes to, despite being 77-year-old, this individual continued to volunteer because the need in their community outweighed the risk for this particular individual. In terms of adaptability, volunteer programs adapted to the changes brought on by the COVID-19 pandemic, including the introduction of virtual services, increased PPE to ensure their services remain open to the public and that their volunteers are able to volunteer in a safe manner. For a small group like Abbeyfield and Lakefield, they remain active in their community. As the quote alludes, they could have just thrown their hands up, but they didn't. One of the ways they did this is turning to social media to lobby for supportive housing in the community. It might have been something that they were planning on doing, but the pandemic just really made them put that in the forefront as they started to do things a little bit more virtually. So in order to think through how we can build back in terms of older volunteerism, post-pandemic, we can think through this framework here on how the resiliency and adaptability speaks to personal, program, and community levels of sustainability, and how these can help to create positive and sustainable older volunteerism in aging rural communities. So if we think about it from a personal level of the older volunteers, their sustainability can be maintained through continued support at the program level. So changes in policies to ensure their safety, like some of the examples that I gave where they put training online, or maybe the best support at that point was to stop volunteering for a little bit to make sure that they had everything in place so when they did come back, it was in a safe manner. At the program level, so for the volunteer-based services themselves, to sustain the volunteer-based services, adapting policies, increasing PPE, and doing virtual programming was crucial to ensure that during a pandemic where many things closed down, these essential community services were able to be open in the community, even in a modified manner. When thinking about aging rural places at the community level, it's really the personal and the program levels working together to ensure that these services remained open to help to support aging rural adults as they continue to age in place. So I wanted to thank you very much for listening. Our report, so both mine and Anne's report, can be found at the link there, the peterborough.trackingprogress.org. If you'd like to learn more about the Rural Aging Research Program, tretu.ca/rural aging. And especially if you're interested in volunteering in the Peterborough County region, I urge you to consider the Age Friendly Peterborough Volunteer Hub. So if you'd like to learn more, or if you'd like to find your ideal volunteering role, please give the number a call or email volunteerhub@comcareptbo.org, and the links will be put in the video description. Thank you so much.
Hello, thanks Amber for starting us off talking about volunteerism during the pandemic. So this presentation is about building back differently through social inclusion of older adults. And I'm going to start by talking about Age Friendly Peterborough that Amber mentioned as well. Because Age Friendly Peterborough are made up of a network of a variety of organizations and seniors, and municipal government leaders and other decision makers. And during the pandemic, we continued to meet more frequently through teleconferences on a weekly basis, really looking at some of the concerns of socially isolated older adults at the onset of the pandemic. And I'd like to thank Trent University Office of Research for funding our research. And our research partners are the 19 listed on this slide, which are comprised of age-friendly Peterborough. And these long-standing relationships were really important, starting as early as mid-2000s, to build upon quick collaboration. And we echoed the findings of what has been known in the literature, that social isolation is that number of connections, but loneliness is that perceived piece. And we found that during the pandemic, it drastically increased in the literature, but our participants, as well as our providers, were saying similar things. And we really wanted to look at how we can mitigate social isolation, as well as understanding the experiences. We drew on what had worked in the past, such as using technology. But we also knew from our providers that rural infrastructure and support was needed for that, particularly seniors. We also knew that caregivers benefited from educational support, but during the pandemic, caregivers were being tapped out as they were. We also knew that intergenerational activities, such as expressive arts activities, using face-to-face, were particularly beneficial at combating loneliness and social connection. But during the pandemic, a lot of those face-to-face collaborations needed to stop, and the intersectoral structures weren't there. So we really came up with these objectives to look at the health experiences, mental, physical, and social, of older adults and their caregivers during the pandemic. We're going to be talking about caregivers, both formal, meaning paid community workers, and formal volunteers, and informal caregivers, which are usually family and friends. We wanted to identify best practices and policies that could support them. And lastly, we wanted to develop some approaches to address those negative impacts. So that group of 19 collaborators came up with the question listed below here on the screen, really looking at the social and health implications of social isolation and coming up with some suggestions. So our study was that of participatory action research, and we really drew upon those collaborations and organizations to reach out to more marginalized seniors and their caregivers and staff. They were able to work through the research ethics board and get approval, as well as helping us recruit participants. We also drew upon them for suggested data collection for a document review that particularly laid the guidelines and policies for data collection that were impacting pandemic actions, as well as that of seniors. So the documents we reviewed are listed here. The first two were pre-pandemic, and the last 8 were guidelines developed by organizations and governments post-pandemic. We did a document analysis, and we found that all of the documents focused on health as the central core goal of the policy or guideline. And they underpinned with supporting principles of inclusion, equity, support, and responsibility. They ventured into guidelines around communication and collaboration among community groups, aiming at safety and protection. Throughout the proposed solutions of the guidelines, we found that principles and equity, the principles of inclusion and equity were largely ignored. What we did find that the actions recommended in the guidelines were around protecting physical health through physical distancing and use of infection control guidelines, and the creation of virtual support programs for older adults and their caregivers. And we also found that legislative policies changed to support virtual visits. The second aspect of data collection were through virtual interviews using Zoom and or telephone calls. So we had 31 care interviews in total, 13 older adults, 9 caregivers, and 9 formal caregivers. And you can see that most of them were female compared to Amber's cohort, which were largely male. We spanned the city and the county and included our First Nations communities. And the average income was slightly higher than our average income in Peterborough City and County. From the analysis, we found that the main health experiences were really an intersection of mental, physical, social, and spiritual health examples. But largely, the mental and social aspects of their health were most at peril throughout the pandemic. For example, the examples given were that of mental strain and worry, and also those altered social relationships. Here are a few examples of quotes to offer just to describe those health experiences. I think I'll read one that highlights the fatigue experienced by a family caregiver. And this caregiver did not live with the older adult, but we can easily imagine it. When I get home at the end of the day, driving home in the dark, and I say to my husband, I don't know how much more I can do this. I can't physically lift her. She's too heavy for me. You know, I come home and my back's killing me. And then a formal caregiver, which was a PSW worker, explained that it's often emotionally draining when you care for vulnerable people, especially if you're involved with them long-term people, which I am. I have connections and their struggles are just hard to resolve the issues for them. So we asked our participants also to provide examples of the kind of supports they needed to stay well in their eyes. And they drew upon 6 proposed supports. So the first 3 involved support for use of that technology that we were bringing out to their home. So Jake, for example, says that some aren't technically inclined, so some support with that would be greatly appreciated. Or even Chris, who was a family caregiver, had never really done that physical caregiving before and talked to it about like jumping into a new career without much training or help or knowing where to get it. And also, many of the participants really were asking for clear two-way collaborative communication, where they found that in their circle of care, whether it was from the participants as older adults or their family caregivers or the agencies trying to service them, that there was very little communication. So Laura said that the client had no clue what was going on. They also wanted supports to age at home, but it was where they wished and if they wished that. And they were finding it particularly hard to get those supports during the pandemic. We know that a number of older adults drew upon volunteers to deliver their groceries, for example. They also asked for funding to support seniors, family, and formal caregivers, that they could actually use the finances to solve their own challenges. And lastly, for those workers in home care, really feeling valued. One quote from a formal PSW said, "They aren't paying us for what is reflective of what we are doing in the community, while we're also keeping people in their own homes and out of institutions as per their preferences." So we then took these findings back to the larger collaborative network of age-friendly Peterborough in a virtual knowledge exchange event. And you can see the 10 recommendations that blend the findings from both of the data sets, but also some background work we also did on recommendations around supportive housing needs and demographic projections during the pandemic. So we asked, now what? So some of the actions at the end of the pandemic that we can look at addressing are really looking at supporting that home care sector and looking at our official plan, looking for accessible housing that's government funding with supports to match our demographics. Locally, our Ontario Health team needs to be resourced more fully to support technological infrastructure and two-way communication with the circle of care. Fourthly, that primary care models can really look at those intersectoral models of care directed towards supporting marginalized seniors and their caregivers, and look at social prescribing models as well as community health centers, which are multidisciplinary in nature and where physicians and all the staff are paid salaries and link tightly with community organizations and volunteers. And really, globally, all policies need to include social inclusion just as a lens of their analysis to support examples of those things like rural transportation and internet service. And those kinds of recommendations hopefully will build on Amber's findings around resiliency and adaptivity and sustaining our personal, program, and community partnerships. Thanks, and if you have any further comments, you can contact me through email at this address.